Good morning again. I am going to talk about today the symptoms that I had before I was diagnosed. I remember looking on YouTube and trying to find out about my symptoms, if there were other people that had those same symptoms. Gastric cancer was like the last thing on my mind, so I was just looking for general information and I really didn't find anything. And then once I was diagnosed with gastric cancer in my stomach, then I started looking for those who had gastric cancer and were telling their story. And I was looking for people that were describing the same symptoms that I had, and I didn't find anything. It wasn't exactly what I had. At least it didn't feel that way. So when I described my symptoms to my doctors, they always just said dysphagia, which as a medical transcriptionist, I know what that means, difficulty swallowing. And that difficulty swallowing really didn't describe what I was going through, because even during the throes of my symptom, I could still swallow. I didn't want to because I was hurting so bad, but I could. And so I didn't really feel like it was on target. But let me describe to you what I experienced. About January of 2025, I started having where I would take my first or second bite, and then I would feel a tightening at the base of my throat. And it really felt like somebody was in there just strangulating my esophagus, my throat. I could breathe, I could swallow if I needed to, but it just hurt so bad. And it literally was like a muscle cramp where you could just feel this tightening, and then it would relax only to tighten again and again and again. And I would be sitting there slapping my knee because the pain was so intense. And I knew that I couldn't continue to eat until this calmed down, because it would just continue to be worse. So that's the symptom that I was looking for on the internet, was that tightening where it just felt like somebody had grabbed your throat and was just squeezing with all their might. And I reported it to my doctor, and I was a little disappointed at his response, because he said, "You need to take omeprazole." I said, "Yeah, but I'm already on pantoprazole, which is basically the same kind of drug, and it should have had beneficial results." And his response to that was, "Yeah, you're right." But he didn't do anything. So I emailed him again, and I told him again that they were so bad and so painful that I was requesting a muscle relaxer, because I had read on the internet that if you had crichopharyngeal spasms, which I thought that's what it was, turns out it wasn't, that if you had crichopharyngeal spasms, that you could take a muscle relaxer and it would relax that spasm. Well, he didn't want to do that, but he said, "Well, we'll just order an EGD." So we got one ordered, but in the area where I live, it's hard sometimes to get recent appointments. Sometimes you have to wait a month or more to get the appointment that you want. And so it was about a month out or so. So in the meantime, I was being followed, as I had said in a previous video, I was being followed for a ground glass opacity in my right lung. And I was thinking that this ground glass opacity was a COVID byproduct, because the internet said that, that's possible. And at the time that COVID started, I was working in the emergency room at the local hospital, and I know for a fact that I had contact with at least 4 patients that had COVID. And it was probably a lot more, because that was only at the beginning. And it reached a point where they stopped telling us when we had contact with a positive patient. So I just assumed that this ground glass opacity was nothing. And after following it for 2.5 years, they finally started to show signs of cancer. So, and lung biopsy showed that it was adenocarcinoma, well differentiated. So it's one of the slower growing contained cancers. So then, as I said in a previous video, they ordered the PET scan, and that's when they found out that I had gastric cancer in my stomach. And the cancer is located in the fundus and the cardia. And the cardia is right at the opening of your stomach. So, of course, your esophagus is impacted by that. So then, once they told me that, it made more sense as to why I was having those spasms in my throat. And I did switch, because omeprazole is an over-the-counter drug. So I did switch from pantoprazole to omeprazole, and it did help a little bit. It actually, it didn't stop the spasms, but it did seem to slow them down, so they weren't as consistent. You know, every time I ate, it didn't happen every time. And when it did happen, oftentimes it wasn't quite as intense. But that was just really, it wasn't the only symptom that I had, but it was the only one that alarmed me. I had been having nausea off and on for probably about a year before those spasms started. But I was always able to write it off with something, because at the time I was having surgery on my hands, I was taking a lot of diclofenac, which is an anti-inflammatory, and it's one of those drugs that when you take it, you can get an upset stomach. So I just thought, well, I'm taking a lot of diclofenac, that's probably what it's coming from. Or there were times that I forgot to take my omeprazole and pantoprazole, and I figured, oh, it's just from heartburn, something like that. I always had an excuse to just write it off. But in hindsight now, I know that nausea was really the first symptom, and I wish that I would have taken it more seriously. So if you're having nausea and you think you have a justifiable reason, don't bank on it, especially if you have risk factors for gastric cancer. And that's me. I'm BRCA2 positive, which means that stomach cancer is on the hit list for BRCA cancers. And I should have reported that. I should have asked for an EGD way sooner. I could have caught this sooner if I had not been writing off my symptoms as something else. And so if that helps somebody out there who's looking for people who have similar symptoms, that would be my advice to you. Don't write off symptoms as something else. It's easy to do, but sometimes it's not in your best interest. If you haven't had a genetic test and you don't know what your genetic risk is, then take a look at your family history. How many people in your family have had cancer, particularly gastric cancers? How many people in your family could possibly have a BRCA2 gene mutation, but they just haven't been tested yet? For instance, how many in your family have had breast cancer or colon cancer, particularly on your father's side of the family, because BRCA is inherited from the father. So in my case, my father had prostate cancer, my sister had breast cancer, my paternal aunts, there was probably 3 or 4 of them that had breast cancer at an early age, in their 40s. All of that was an indication that I was BRCA2 positive. And sure enough, when I got tested, I was. So don't write off symptoms because you think you know where it's coming from. Take a look at your family history. Ask for genetic testing. I believe in Vitae, where I had my genetic testing, they don't even require a doctor's order. You can simply request it and get it done. And they'll send you the kit, and you take it to your local lab, and then the lab follows the instructions and sends it in. So if you think that you have family history that warrants genetic testing, please get it, because it can change how you are followed by your physician. It can change how you view your symptoms, and it can make a world of difference in your life. You can catch things so much earlier, and then you don't need chemo like I did or do. So that's my recommendation to anyone who found this video because they were searching for people who had similar symptoms. And I hope this is helpful to you, and thank you for watching. Bye.